Hello again. Addressing the historical impacts of colonialism requires looking at holistic approaches, and this includes incorporating traditional medicine and healing practices to interact with and offer alternatives to Western medicine. There is a recognition of a lack of understanding as to what traditional medicine and healing practices are within the Western context. So, below I have provided a table just contrasting the use of traditional versus Western medicine approaches for your review. The WHO defines traditional medicine and indigenous healing practices as the sum total of the knowledge, skill, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. Elders are also considered the holders or executors of traditional medicine and healing practices. However, it is important that we distinguish between these practices as well as because they are differing activities and may require another distinct role. So let me explain. So regarding medicinal practices, picking plants safely and sustainably to ensure that healers will continue to have access to plant medicines is a separate function from processing and applications of these medicines, which are both learned and preserved. Now, elders use help from healers and knowledge keepers to apply these medicines to healing practices. So this is where we see the differential roles between elders, healers, and knowledge keepers. You can go ahead and play that back if that was a little bit too quick for you, but a little bit of a tongue twister there, but I hope that made sense. Ceremonies as a form of healing practice is a cultural activity that is believed to be an integral part of bringing self-care and health to Indigenous people, and it is also considered good cultural medicine. And Logan A.L. mentioned that when the acceptance of the Canadian government in honoring the statements of the UN DRIP, as well as the TRC calls to action and the accompanying healthcare institutions emphasizing person-centered care, there is a strong recognition for health practitioners to support patients' decision to use Indigenous healing practices. So that's good. As a result, to support the reconciliation of medicine, it was proposed that practitioners be open to studying any traditional practice and be funded. In addition, Indigenous healers should actively be included in the process through education programs, which will be discussed on the next page. So I will see you there.